Artery number 26.
There's the marginal artery.
Okay, so this is the marginal artery. Okay, if we continue all the way around, we're going to form the posterior interventricular artery. Posterior interventricular artery. Remember, these arteries, they sit into its respective groove, right? The groove is nothing but a sulcus, so the sulcus is a groove. So if I tell you posterior interventricular sulcus, well, the posterior interventricular artery, it sits into that groove. Okay, the same thing as the anterior interventricular artery, it sits into the anterior interventricular sulcus.
So the artery and the sulcus are basically in the same place.
In the same place. So the artery sits into it. Okay, so now that we know the various arteries, right? Let's look at the fossa ovalis, right? Fossa ovalis and ligamentum arteriosum. Okay, so we go to the right atrium, right? And right here, I'll point to, and each of you could come with your cameras. It's point 81 there, right? And that is the fossa ovalis. Now, the fossa ovalis originally in utero is called the foramen ovale. The foramen ovale is the open one, and that's in utero. But when the baby is born, it closes, so we call it the fossa ovalis. Not all the time it closes, sometimes it remains open. Obviously, we have to give the baby drugs like indomethacin, and it will close, okay? If not, it has to be surgically closed. So that's why we say a hole in the heart.
Oh, like her.
Okay, all right. So next one is the ductus or the ligamentum arteriosus. So here's the ligamentum arteriosus is right here. Okay.
What number is that? 13? Is that,
I'm not sure. All right, ligamentum arteriosus. Okay. Next one we want to find is the ascending aorta. So it goes up, right? So we see this region here is the ascending aorta. Then it arches, so we say this is the aortic arch.
Okay.
Now the next one is the coronary sulcus. So we'll expect that the coronary arteries will sit into the coronary sulcus, right? Next one we're going to look at is the the interventricular septum first. This right here is the intraventricular septum. Okay, that's number 67. All right, the next one are the auricles, right? We have both the right and left auricles, right? But you'll see that they also say it's the atrium, right? But we know the atrium is a chamber inside, so nobody gets confused on exam day. If it's on the outside here, I want you to say the auricle of right atrium or the auricle of the left atrium, so there's no confusion. Okay. Now the next thing is the trabeculae carnae. Okay. The meshwork we see right here in the ventricles, meshwork here, especially here, you can see a lot of it. This right here is the trabeculae carnae. Okay, it's number 64, if I'm not mistaken. Trabeculae carnae. The next one, of course, we're going to identify the various chambers. Of course, this is the right atrium, the left atrium, the right ventricle, and also the left ventricle. The next thing we'll identify is the chordae tendineae, and that is these strings we have. These strings are normally attached to these muscles. Okay, these muscles are called papillary muscles. Okay, and they're important for opening and closing of the valves. So you have a number of papillary muscles. For example, 61 is a papillary, 62, all these here are various papillary muscles. Look at a nice big papillary muscle right here. Okay, number 76. Okay, those are the papillary muscle. Right? Let's go and do veins now. Okay, so anything in front is great, right? So that's why I call this one the great cardiac vein, which is number 31, great cardiac vein. If it's behind, I'll call it mediocre, right? So this is the great cardiac vein going down here, but it also runs all the way around. Okay? So it runs